Welcome back. April is Oral Health Month. We have Dr. Preety Desai here to talk about that. Welcome back to the show.
Thank you so much, Susan.
Yes. What is the message or the public awareness campaign for April then?
Well, of course, dentistry is taking over April, including the Cancer Month. So I thought I would combine the two and get some awareness going. And one of our first images will reflect that. Just because something doesn't hurt in the mouth doesn't mean that there's not something serious going on.
Exactly. So let's take a look at this.
Yeah.
This sort of lends some insight to what's going on below the surface.
Exactly.
Might be the big thing.
Exactly. So the metaphor of an iceberg is that the majority of the damage that could be done is below the visual access that we have. So it's really, really important to go to your dentist, obviously your physician, but dentists are so used to looking in the mouth every day. So we actually identify more oral cancer than the physicians do because we're used to looking in the mouth every day. And we know when something doesn't look quite right and we can send it off for further analysis. Right? I mean, the last thing you need is something silent and all of a sudden 2 months later you ignored it and it becomes a big issue. How
directly linked are good oral health and mouth cancers?
It's great that you brought that up because they're hand in hand, right? And what you want to do is identify it early. And there was a big Australian study done, and what they identified was 5 big risk factors. One was smoking, alcohol, and the combination is even worse. If you are of the lower socioeconomic, you just don't tend to take care of yourself quite as much. Loss of teeth is #1. So people with dentures are actually at higher risk for getting oral cancer just by traumatic rubbing, irritation. It exacerbates the tissues in the mouth. And the last is HPV, which is a more recent kind of diagnosis as well.
Can we talk about that one, HPV?
Yeah, so human papilloma virus, which of course our awareness through the healthcare community of girls getting vaccinated to protect against obviously the virus, but it is sexually transmitted. And if people are experiencing HPV, the rate of cancer goes higher. And it's a younger cohort that's identified, and it's not just women, it's men as well. And if it's not diagnosed early, it's under 55 is the main risk factor age, right? And you just don't want to go there because once it metastasizes, your prognosis is very poor.
Is that right?
Yeah, and there's a big study out of Princess Margaret Hospital in Toronto where I did some work there as a resident, and they are right on it. They're doing the biggest study ever on HPV oral cancer.
Very interesting that these things are all connected.
Yes.
Obviously, smoking is a huge one.
Of course.
What I found interesting in reading what you sent to me was about mouthwash.
Yes, and there's more options today where mouthwash has no alcohol, but all the ones that were manufactured early on had all the alcohol content quite high. And even menthol, which is good tasting, is not considered alcohol, is related as a cousin of alcohol. So alcohol in the mouth, we already talked about, it's high risk for cancer. And what it does is it actually dries out the tissue and allows toxins and other pathogens to enter into the tissue. You know, when you have dry skin and it feels irritated, well, why wouldn't the mouth be any different?
So it's for people who, it's not like using mouthwash is going to be immediately dangerous for you, but if you're using it like 3 times a day or more, that's when you're, so if you're using mouthwash 3 times a day or more, maybe don't.
Don't do it. Brush and floss your teeth.
We just had that picture on. If we could put that back on. Sorry about that. Downstairs just put that on for me. But it's a picture of a mouth. What are we looking at here?
And so it's the exact same mouth. The left, obviously, is what you look at when you're in the dental office. But the right is where you put on special filters and you can identify a little dark spot on the right, and that's oral cancer. Whereas on the left, what can you identify? Something kind of vague and not clear. And so we dentists have these screening exams that we use, veloscope, special goggles and glasses that we put radiation light, like, you know, the light curing that you have in the dental office when you're getting a white filling. And so you can put that light on the tissue where these filtration glasses, you can identify what was kind of okay looking to something that we need to investigate or even biopsy.
Okay.
So, you know, it takes like a regular exam from here to even a higher level.
So sitting at home and brushing your teeth and looking in your mouth does not, and it looks good to you, that doesn't mean a darn thing.
No.
Come in and get it checked. Make sure that you're on the up and up.
Yeah, and even me looking in the exam operatory, I'm like, you know, that doesn't look quite right. I'll put on my veloscope glasses and have a look at it going, yeah, you know, we need to investigate, or no, we're just going to watch it right now.
Anything else you want to mention about April being Oral Health Month?
You know what, the big thing is, you know, facetiously I sent the iceberg. It's kind of funny, but it isn't. The majority of the patients that come into my office, they're like, I'm not sure why my dentist referred me. I feel nothing, you know? And I hear that over and over again. And it's not the first symptom that comes to your mind when you want to go to the dentist. The fact that you feel nothing doesn't mean nothing's going on.
Very good. Good message. Thank you very much for being here today.
Pleasure. Thank you.
All right. Information on the screen. If you would like to get a hold of Dr. Desai, either by website or by phone number, you can certainly do that. We are back after a quick break. Stay with us.